Conditioning is a pre-treatment regimen that is an important step in the patient journey before receiving certain cell and gene therapies. It is often given before an ex vivo approach. This is when a person's cells are removed from the body and then modified with genetic material. These modified cells are then returned to the body to deliver the treatment. Conditioning helps prepare the body to accept the modified cells long-term. This could mean creating room in the bone marrow for the new modified cells, or temporarily suppressing the immune system so that it doesn't interfere with the therapy. Conditioning regimens are typically given via IV and often include chemotherapy, which is a drug used to get rid of fast-growing cells. The specific conditioning approach is carefully selected by a doctor based on the disease and treatment protocol. The two main types of conditioning are lymphodepletion and bone marrow conditioning. Lymphodepletion temporarily lowers the number of certain immune cells in the body. This makes room for the new or modified cells and reduces the chance that the immune system will attack them, helping the therapy work as intended. This kind of regimen is most common in immune-based cell and gene therapies, like CAR T-cell therapy to treat blood cancers or solid tumors. Bone marrow conditioning is given to eliminate the existing blood-forming stem cells in the bone marrow to make room for the new treated cells to grow. This process is common for blood disorders, such as sickle cell disease or thalassemia, where the genetic variant affects the formation of these blood cells in the bone marrow. Let's talk more about how conditioning fits into the treatment journey. The length and intensity of conditioning depends on the type of therapy. In general, recovery from lymphodepletion is typically shorter, while bone marrow conditioning is more intensive and requires a longer recovery period. If a person is eligible for a cell or gene therapy, they will have their cells collected, which are then sent to be modified in a specialized lab or facility. Once the modified cells have returned from the facility, the person receives the conditioning treatment, either lymphodepletion or bone marrow conditioning, to prepare the body. After completing the conditioning regimen, the individual receives the infusion of the modified cells at the hospital, which usually takes about an hour. A recovery and isolation period then follows for several weeks, along with multiple follow-up appointments to ensure the therapy is working as expected. It's important to understand the risks of a conditioning regimen when choosing to participate in a clinical trial or receive a treatment that requires it. Conditioning, along with the treatment itself, can require a significant time commitment and affect daily life. For example, you will likely be required to stay in the hospital to allow the body to recover and reduce the risk of infection. Ongoing monitoring may be required for several years after treatment and is more common in bone marrow conditioning. Along with infection, chemotherapy can cause short-term side effects, such as hair loss, skin shedding, and tooth or mouth issues. In some cases, long-term risks include bone damage, cancer, and while not common, there have been instances of death. Chemotherapy can also affect fertility, so it's important to consider future family plans and whether to pursue fertility preservation services before treatment. Every conditioning experience is unique, and understanding what to expect can help you feel prepared and supported throughout your treatment journey. To learn more, visit patienteducation.asgct.org.